We have 3 items on consent. Item number 5, AB 1823, item number 11, AB 2053, and item number 17, AB 2279. We don't have a quorum. Once one is established, we will interrupt the testimony and get one established. Looks like I see Assemblymember Eggman on the front row there. If we can have her come up, we'll start off with item number 1, AB 38, Mental Health Early Diagnosis and Preventative Treatment Programs. Good afternoon. Yeah, and then we'll have your presenters over here. Good afternoon.
Perfect. Good afternoon. And thank you for hearing this bill today. AB 38, at its heart, is about improving access to mental health services for young children encountering early psychoses. And as you may know, a psychotic break for anybody, but especially for a child, is one of the most hard to treat and most expensive diagnoses somebody can have. One of the hallmarks of a psychotic disorder includes schizophrenia, mood disorders with psychotic features, and often that, by definition, that individual can lose touch with reality. As you can imagine, this is incredibly hard both on the patient, the person experiencing this, as well as family, especially when we're talking about younger children. Both medication and therapy can be effective at working with these, but oftentimes they're not sufficient for people engaged in a real psychotic breakdown. Programs in both the United States and Canada have shown promise by really doing wraparound services. And I'll say that I started off this bill wanting to have a social worker in every single public health school in California so that we could really begin addressing mental health at an earlier age. And kind of looking at how we do that, the reality becomes much more difficult than the ideal or the idea. So we really looked at what was it that we could do. And so when looking around, there are some wraparound programs. So there's one in Sacramento called the EDAP program, works between the UC Davis Mind Center, but contracts with Sacramento County and uses the mental health Prop 63 funds. So they have something called EDAPT, Early Diagnosis and Preventative Treatment. The MHSA talks about this as the outcome data in this program really shows an improvement in clinical outcomes. One of the things that you find in treating schizophrenia and psychotic breaks is the faster you get somebody into treatment to turn that around, the better the chances are for a successful outcome for the rest of that person's life. So the program currently treats mostly only Medi-Cal to its fullest extent. So Medi-Cal pays part of it, and the MHSA funds pay another part of it. They can do a full wraparound. They've got great outcome data. So what we're trying to do is encourage private insurances to offer these same kinds of treatment. And what we can't really mandate or encourage, we want to show through actual data that these programs work. So this proposal is just to do a pilot program for a period of 4 years. UC Davis will then prepare a report for us detailing that back, that if we include private insurances in that same pool, we're hoping their outcomes will be similar to the clients who are on MHSA as well as Medi-Cal. So this comes with a cost. So the extra services will come at a cost about $3,000 to $5,000 each client, $8,000 each client, for a total of about $180,000 to be able to pilot this program for a period of 4 years, hopefully show other private plans that this is an effective model to be able to treat young people, especially with early psychosis, schizophrenia, to have better lifelong mental health care. We have witnesses here in support.
Thank you. Please state your name and your position.
Mr. Chairman, I'm Randall Hager, representing the California Psychiatric Association. Just to kind of pull it back to a higher level, I think it's really clear that psychotic disorders are very important, and it's evidenced by the fact that of the top 3 diseases that have the highest global burden of disease, psychotic disorders are there and as number 3. It affects 2 to 3% of our population, 1% with schizophrenia. That means in California, for schizophrenia, there are about 390,000 people. For all the other psychotic disorders, it's either double or triple that. So it is a major public health issue when psychosis is not treated. There's a lot of research that's been developed in the last 10 years that demonstrates that there's a direct linkage between the duration, between the onset of symptoms and the actual treatment that determines outcomes. The longer the duration, the less good is the outcome. There's also an emerging consensus about what the treatments are that can interrupt the cycle of inevitability, where a person who does get diagnosed with schizophrenia is inevitably someone who ends up on social benefits in a very deteriorated condition. They can't hold a job, they don't go to school. So these programs actually interrupt that arc, and there's good evidence to suggest that not only do they work in all other parts of the country, but Sacramento County, as Ms. Aikman says, has a very robust program with very good results. And so we're hoping to demonstrate that we can, and I think this is a first in the U.S., not only work this in the public sector in where we have Medi-Cal funds available, but also do it in the private sector. I do not think that there is another program or a proposal to work this kind of a program with private insurance and the health service plans. So we think this is very, very important. We think it's a new model of care that we're hoping, as the Assembly member said, to demonstrate efficacy and to get involvement on the part of the health plans.
Thank you.
Jim Gross, also on behalf of the California Psychiatric Association, just to make a couple of key points. This is actually targeted at the insured population because there are gaps in services, unfortunately. It really is not an issue of whether health plans are denying coverage. It's more a question of how you give access to the insured population to these types of wraparound services. And we believe that if patients can enter these through the insured side, they're going to see the same kind of results that, frankly, we are seeing in the Prop 63 side. Unfortunately, those funds are not available for these services, and because health plans do not cover all of these services, we need the extra resources for those who are insured who go into this program to be able to get the full array of services that are part of that wraparound system. So we think that we are addressing a need that perhaps doesn't always get focused on because we do focus so much on the Medi-Cal population and the homeless mentally ill, which is a very important population. Well, frankly, we're trying to get the insured population the same opportunities. Thank you.
Thank you. We're going to try to go ahead and establish a quorum. I think we have the members here. We can call the members.
Hernandez?
Here.
Hernandez here. Nguyen? Here. Nguyen here. Hall? Mitchell?
Here.
Mitchell here. Monning? Here. Monning here. Nielsen? Pan? Here. Pan here. Roth? Wolk?
Quorum has been established. Sorry, please proceed. Anyone else in support?
Rebecca Gonzalez, National Association of Social Workers, California, chapter in support.
Thank you.
Teresa Anderson on behalf of California Academy of PAs in support.
Anna Hasselblad with the Steinberg Institute in support.
Opposition? Questions, comments? Any of the members? We have a motion by Senator Nguyen. Would you like to close?
I would just thank you for your support on this bill today. I think it's an important step as we move forward to really addressing mental health issues in the state of California. Eventually, we'd like to take this statewide, but for now, we're going to start with this demonstration project right here to prove that it's effective and it works. I respectfully ask for your aye vote.
We have item number 1, AB 38, due pass to appropriations. Call the members.
Hernandez?
Aye.
Hernandez, aye. Nguyen? Nguyen, aye. Hall? Mitchell? Mitchell, aye. Monning? Monning, aye. Nielsen? Pan? Pan, aye. Roth? Wolk?
That's 5-0. 5-0. We're going to place that bill in call.
I rinsed it out my cup. TMI.
Okay, we're in item number 2, AB 1668. Oh, yeah, I want to make sure I saw Assemblymember Calderon, investigational drugs, biological products, and devices.
All right, thank you, Mr. Chair and members. AB 1668 will allow patients with a terminal illness to seek investigational drugs and treatments under the supervision of a physician in order to try and save their own lives. This bill requires written informed consent be given by patients, institutional review boards oversight, of physician recommendations and biannual reports to the Department of Public Health to ensure safety from for both patients and physicians. AB 1668 is simple. If your parent, your child, or even you are faced with a terminal illness, then there is a process in place for you to seek potentially life-saving treatments. This bill is substantially similar to AB 159, which I put forth last year. The bill was vetoed by the governor with instructions to give the Federal Drug Administration expedited compassionate use program a chance to work. However, the streamlined FDA compassionate use application, it's not in youth, it's been approved, but we don't believe it's actually going to take any time, wait time off of it. They just made a small change, which we don't think was substantial enough. But yeah, in the meantime, terminally ill patients are still waiting months to gain access to investigational drugs, which could potentially save their lives. And terminally ill patients do not have the luxury of waiting. We must act now to ensure that they have access to investigational drugs and treatments that may save their lives. I ask you to please vote aye on this measure, and with me today to testify in support are Martha Guerrero from the County of Los Angeles and Kurt Altman from the Coldwater Institute.
Thank you, welcome, and please proceed.
Good afternoon, Mr. Chair, members. Martha Guerrero, representing the Los Angeles County Board of Supervisors. Patients with a life-threatening disease or condition who have exhausted their options to find a cure and who have identified physicians and a pharmaceutical company willing to assist them deserve the right to experimental treatments that could improve their health conditions or prolong their lives. I have a very good example. My brother-in-law has been diagnosed with ampullary cancer, stage 4, since October 2014. And unfortunately, the chemo that he's tried has not prevented the growth of this cancer. He's moving on now with the City of Hope to find other treatment options. But at this time, it's legislation like this that would help him find other treatment options to prolong his life and be able to see my little niece grow to adulthood. So for these reasons, we ask for your support in this measure.
Anyone else in support?
Mr. Chair, members of the committee, thank you again. As Assemblymember Calderon said, my name is Kurt Altman. I am here on behalf of the Goldwater Institute. I was one of the original drafters of a model legislation that has run around the country called Right to Try. AB 1668 is similar to that, the one that was drafted and designed by Assemblymember Calderon. I'm here just to let you know that I have traveled the country. I've been to about 40 states now, testified on bills just like 1668. I've worked with physicians. I've worked with people that are actually implementing and receiving medications under Right to Try laws. And I've seen its difficulties, I've seen its successes, and I've seen it develop over the years. I am here really to let you know that I can answer questions that you may have. Assemblymember Calderon explained what the bill does. I've had the privilege of once before, maybe twice before, testifying before this committee. So I'm not going to belabor the facts of what 1668 does, but I am here to offer my assistance and answer any questions as to its implementation, as to how it relates to the compassionate use program, as to its legal basis. Anything this committee may have that I can help with, I'm here to offer. And if you don't have anything, I certainly would ask you for an aye vote and to move this along. It's a fantastic bill, and I appreciate the invitation from the Assembly member to speak to you all today.
Thank you. I'm sorry for the interruption. We just have some disruption over here to the left. You know, Senator Halls has a tendency to make these grand entrances that kind of disrupts the process, you know. Anyone else in support?
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Opposition? Seeing no opposition, concerns, questions from any of the members? Senator Pan?
Thank you so very much, and I want to thank you, Assemblyman Calderon, for bringing this bill forward. I know this is an issue you've been working on for a while. I do have a question about the role of the IRBs. I understand that you did have to take some amendments as it went through the Assembly, and I think the question is related to being sure that to achieve the aims of your bill, that we want to be sure people have access. And certainly IRBs play a very important role in the research world in ensuring that we have proper treatment of human subjects. But of course, your bill is about compassionate use, so actually it's actually for people who are using it outside of the research protocol. But what we're calling on is that the IRBs are, well, we're going to ask IRBs to approve consent forms and even report to the state in relation to the number and so forth. And my concern is that, I don't know if you've had any conversations with IRBs. I don't know if there's, I'm trying to recall that I don't think there's a professional association of IRBs or not, but in terms of their willingness to engage in that. And I guess what I would hope is that there's that there's some conversation with the folks who perhaps suggested you take those amendments, and also people in the research world, in the IRB world, about being sure we appropriately define the role of the IRB in a way that the IRBs will be able to help support what you're trying to do, and also assure, of course, the protection of the patients. And I know that that's one of your top concerns, and that's why you took the amendments and so forth. I just want to be sure that this bill will actually achieve the aims you seek, and that we're not creating an additional barrier where an IRB may not be comfortable doing the tasks that this bill, hopefully law, will then require. And then people still can't get access. So I guess I would just urge you to ask you to hopefully engage in the discussions if I can be helpful in any way as well. So thank you.
Thank you, Senator, and I appreciate your comments. Absolutely, there was amendments last year that were proposed by an assembly committee, which we indulge for the sake of providing the extra measures in place, putting extra measures in place to make sure that patients were taken care of, and that proper protocol was being followed, and that there were enough checks and balances so that patients who were seeking these investigational drugs were doing so in the safest manner possible. So I understand your point, and we have talked before this, and so I really appreciate your comments, and I look forward to working together on this issue, and your leadership, of course, is great. I'm not a doctor, you're a doctor, so I'll take your advice.
Thank you. Seeing no other comments or questions, is there a motion? Moved by Senator Pan. I will be supporting the bill. I know it was vetoed by the governor. Hopefully, I think we've resolved any of the concerns with regard to the FDA. Hopefully, you can look at getting a signature. Otherwise, would you like to close?
Thank you, members, for your time. I respectfully ask for an aye vote.
Item number 2, AB 1668, do pass to business and professions. Call the members, please.
Hernandez. Aye. Hernandez, aye. Nguyen. Nguyen, aye. Hall. Hall, aye. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Wolk.
Currently has 6. That's enough to get out, but we're going to place that bill on call. We have members that are absent. So I believe you have another measure. It's item number, where is it? Item number 13, AB 2079, skilled nursing facilities.